cancer is a tumor that originates inside the lung, and it can start from an abnormal transformation of cells that are either from the lining of the airways or from some glands inside the lung. And these are the most common types of lung cancer. We call them non-small cell lung cancer. There is a third type of cancer, we call it small cell lung cancer, which tends to be quite aggressive and is rarely treated with surgery, even if I have quite a good experience in performing surgery for early stages of small cell lung cancer. Symptoms of lung cancer can be quite specific and maybe misinterpreted or neglected for a period of time, but generally speaking, you get a cough that doesn't resolve within few weeks. Occasionally you might cough up blood, can lose weight, and then some other specific symptoms like tiredness, and occasionally you might have some symptoms that are, we call them paraneoplastic, so something that is caused by the cancer producing substances that are similar to the hormones in the body. Yes, unfortunately they do. There is most of the lung cancer nowadays is affected by cigarette smoking. Nevertheless, genetic also plays a very important role in the development of lung cancer, and I had several patients never smoke a cigarette in their life and yet they got a cancer. That does not mean that we're encouraging smoking, because as I said, of course it still plays a major role in the development of cancer, but it's not the only thing. Yes, there are. In my hospital, we just finished one screening. At the moment, there is nothing available to the general population that is being proven. We just, as I said, completed the study. We are analyzing the result, and we'll see whether there is a benefit in screening patients for lung cancer, although it's an appealing concept of being able to pick up potential cancer early. But the problem is that there are always small nodules in the lung that are perfectly indolent, are not causing any trouble, and are completely benign, that get picked up during screening, and sometimes they trigger a lot of unnecessary investigation that would not have been done if without the screening. So I know that, as I said, there's been just concluded a program in the UK. There was a similar study in the US, but we haven't got the results yet, so we need to see whether it's appropriate or not. There are companies that offer blood tests, screening, something, but they are not proven. Mostly cigarette smoking, then exposure to gases and like radon, and genetic predisposition. It depends on the stage of lung cancer. Usually early stage lung cancer are treated mostly with surgery or a combination of surgery and chemotherapy if the tumor has spread to the lymph nodes in the middle of the chest. More advanced form of cancer usually are treated with a combination of chemotherapy and radiotherapy. Well, usually every time I see a patient, I make a personalized plan after discussion in our multidisciplinary meeting with other cancer specialists, so chest physician, they have an expertise in lung cancer, pathologists, radiologists, oncologists, and radiotherapy. So we look at the patient history, we review all the images, and then we try to determine how advanced the cancer is and where it has spread, and if it is as I said, localized, normally we recommend surgery, and I try to perform most of the time a keyhole procedure rather than an open procedure. Occasionally it does, but this is only true for very large tumor that are invading organ in the middle of the chest or are very close to the middle of the chest where the blood vessel goes into the heart. In most of the cases, if in an early stage lung cancer, normally we can treat it by a keyhole approach without the need to spread ribs, and occasionally can be done with just one cut about this size, and other times we have to make 3 small cuts, but patients have recovered very, very well from that. It mostly depends on how fit you are, in the sense, if a younger patient that maybe never smoked very little, and have a very good lung function and have no other medical condition, usually tend to stay in hospital very little, sometimes as little as 24 hours. Most patients stays about 48 hours, and occasionally, if the tumor is very big, if the patient is old and needs a little bit to recuperate from the operation, it might take maybe between 3 and 4 days. But on average, I would say 1 to 2 days for most patients. Well, it's very difficult to give a generic recommendation. It usually depends on how much lung reserve you got. So again, if you never smoked and you have a very good lung function, as you walk every day, it's reasonable to think that you're quite fit, therefore you can afford to lose half of your lung or even an entire lung and still be able to breathe comfortably with no problem. But again, you smoke all your life and the lung function is not very good, then there is a limit of what we can do. Usually, sometimes it happens with heavy smoker for a long period of time that yes, to do the operation would be very easy for me, but then I can't do it because they haven't got enough reserve to tolerate the removal of a part of the lung. So the recovery is variable. Generally speaking, it might take up to 2-3 months to feel completely normal as before. But as I said, with the keyhole approach, this time has been shortened enormously. It depends on how fit you are. As I said, if patients smoke all their life and have poor lung function, it might take longer. Generally speaking, though, with the keyhole approach, most patients can go back to their normal activity within a few weeks.